Hello, everybody, and welcome to Positive Live. I believe this is our 7th show. Things are just moving right along, and everybody's getting the good vibes going on. Today, it's an absolute pleasure that I introduce you to Jeri Schulz, right? Schulz.
Schulz.
Yeah, with an L. And Jeri is an RN and has her master's in nursing, is also the founder and CEO of Tulip Tree CBD, and the other business is called Dosing, which works right in line with that. So welcome, Jeri.
Hi, thanks for having me. I'm very happy to be here, Jan.
Yes. And Jeri comes from Cincinnati, Ohio.
Yeah. I'm a native born Chicagoan, but transplanted down to Cincinnati. So Midwest girl.
So how long have you been interested in starting a CBD business? Kind of give us a little history of what made you decide to go in that direction.
So I started Tulip Tree CBD because I was actually, for my own needs. I've been a nurse of 20 plus years, ICU, hospice, cardiology, all of that. And I was, as I got older and as my nursing teams got older, we have arthritis and all these aches and pains. And I was starting to take, prescription anti-inflammatories, a lot of Tylenol, a lot of ibuprofen, and it was messing me up internally. So the doctor said I had to stop. So I was kind of forced to find a natural alternative. And that's when I started investigating and researching CBD. And the more I learned, and the more popularity that grew with CBD, the more I realized that there was a lot of discrepancy in the quality of the products that people could get, and the information and the transparency. So I started testing a lot of CBD products out there. And I found a manufacturer in Colorado who pretty much manufactured exactly the type of product that I'd want to take myself and that I'd want to offer my fellow nurses. Nurses are getting older, and they all talk about the nursing shortage, and experienced nurses need to stay at the bedside longer, and they have all these aches and pains, but they can't take all these meds. So
Right.
I decided to open Tulip Tree CBD to offer, my nursing teams and all the healthcare providers across the country a viable solution to their aches and their pains, and to keep them direct with patient care longer without having to take over-the-counter or prescription medications.
Right.
So I don't have any THC in my products, which is something that, the feedback I got from all the nurses is we won't take it if it has THC in it, because a lot of them have to drug test.
Right. Yeah, exactly. And then they don't want to keep taking opiates, pain medications. That's not good. And then you're not sharp on the job. So
Right.
how does this product here, looky here.
Look at that.
There's,
That's my gummies.
there's the little gummies, and
Yeah.
I'll go into this a little bit in just a little bit. But yeah, so we can't have our head be fogged. And then again, it's not good to take a lot of pain pills, because you can get drug tested, although it's legal if you have a prescription. But as we all know, it's very easy to get addicted to those, and then it's not enough, and you have to keep taking more. And then it causes other side effects like severe constipation and just mood changes and stuff.
Right.
So, and then you can't take, we've all heard about great THC products, especially for cancer patients. And along that line, that it really helps with pain and increasing appetite.
Nausea and vomiting. Yeah.
Right. But we can't take that. We're on the job, and we don't want to be stoned. Well, I don't anyway. I want to be able to be focused and not be like, hey, let's sit back and chill, man. Right. So what did you find with the CBD, and what is it work best for?
So I look at research, and there's a lot of information out there. And there's a lot of research out there, but there's not a ton of really good research. And I found that as a nurse, you know, I wanted to base my company on scientific data. And
Right.
what I found is some of the pharmaceutical companies that have done research on CBD have done the research on CBD isolate, which means that it's just the CBD molecule alone and not all of the complementing cannabinoids that go along with a broad spectrum or a full spectrum product. So when you're dealing with isolate, you're dealing with much larger milligram doses because it just doesn't work as effectively. It's cheaper, so you'll see CBD isolate in a lot of food products because it's cheaper and also it has no taste. But when I was looking at it, I found that the broad spectrum, which is all the complementing cannabinoids and terpenes, but without the THC, a full spectrum has all of that plus THC in it. So the broad spectrum was able to give people the medicine that they needed, the help they needed for inflammation, for anxiety, for, you know, I have GI symptoms from all the pain medications and the anti-inflammatories. CBD is wonderful anti-inflammatory, and there's a lot of solid research out there talking about CBD as an anti-inflammatory, even if you use it with THC. And what it does when you use it with the THC is it helps mitigate the high from the THC.
Right.
So if you need to take, if you need to take THC, if you have a medical card, it's always a good idea to have a product that has CBD, a balance of CBD in it. And especially if you have to take it during the day, like you said, you know, we can't be high and function properly. So you want to have a clear head, you want to be able to function, but you want to be able to do it pain-free. And that's where the CBD comes into play. It's able to do all of those things for you. And it does all of those things because it interacts with our own body's endocannabinoid system.
That sounds very interesting, and I'm betting the audience is like, what was that word?
I know we
Could you
didn't learn
explain a
that
little
in nursing
bit more
school.
about the breakdown of, and so you're saying that the CBD has other molecules in it besides just that isolate.
Right. Well, it depends on the product that you're getting. So CBD itself, in and of itself, is one of the major cannabinoids. In any cannabis plant, the two major cannabinoids are the THC and CBD. But then you've got all these other minor cannabinoids and terpenes and other properties of that plant. So when you're taking a CBD product that says broad spectrum or full spectrum, you're getting these other complementing cannabinoids that enhance the properties of the cannabis,
Sure.
of the CBD.
So can I ask a question?
Right. And it's a part of, sure. Just
So-
remember, Christy, when you're done, to put yourself back on mute.
I
So
will.
we don't get feedback. Okay, go ahead, Christy, take it away.
So I have some experience with, so I'm a massage therapist and I also make my own medicine. And so I make THC products. And I've also been a heavy user of CBD products as well. So I'm interested because I fully understand what all you're talking about. My experiences with the products of CBD that I've had and I've tried to use with my patients, they will test at 0.004% THC, which is so minimal that it doesn't trace, you know, so like if I just put it on and that's all I used was that CBD, I wouldn't test positive for THC. But if people become heavy users, then what would happen is that percent starts to increase because they're using it all the time. And then they start to test positive for THC, yet people are saying, no, there's no THC in this product. Have you had any experience with that?
Okay, yeah. So there were a couple things that you said in there that I'd like to address, Christy. And one of them is, first let's address the THC in the products. The legal limit for a product to be considered hemp and fall under the Farm Bill and be legal is 0.3% THC or less. And there are a lot of products out there. So unless a product that is CBD says THC free, then there's a good chance that it has at least 0.3% THC or maybe less. My products and the manufacturer that I chose, they go through an extra filtering process that eliminates all the THC. So my products test out on all my third-party labs, which is on my website, at absolutely 0.000 THC. Now, people may test positive if they're taking CBD that has that 0.3% or less of THC in it. If they use a great deal of it, because it is fat soluble, so
Yeah.
THC, it stores in your fat, right? So as you know, as your fat stores accumulate that, that's why pot smokers or THC consumers, you know, if you smoke one joint or if you take one dose of THC, you know, a week later you're going to test clean and not positive. But if you do that on a daily basis, you accumulate that in your system, and it can take 6 months, somebody told me it took them, to clear it completely out of their system if they use it on a regular basis. And that's the THC. CBD does not show up at this point for the current testing that we have on any tests, drug screens. So it's the THC that they're really testing for. But Christy, as a massage therapist, if you're using it topically, then it's not absorbing into the bloodstream. So even if you have a small amount of THC in there, your customers, your patients should not be testing positive unless they're ingesting it, and they're ingesting it on a really regular basis. Does that make sense?
Yeah, I just have some that, you know, with it being in the profession that I'm doing on workman's comp and stuff like that, I can't take a risk. You know what I mean? I have to know if it has THC in it or not, and if I can use it or not, because
Sure.
that's just, yeah.
And then, you know, Christy, and that's why when you go on my website and you look at the individual products, each one has a third-party lab test. So my manufacturer provides me with lab tests. They call them certificates of quality, but I pay the extra money to get a third-party lab to test it again, to compare it against what my manufacturer gives me, so that I know that if I tell you that there's 20 milligrams of CBD in this product per dose and 0 THC, I can be confident, and you can see the labs. So I have complete transparency on that. So you can see the labs for yourself that it is absolutely 0 THC, and be confident about using it and not testing positive. So, you know, and that leads me to the other thing, Jan, that you mentioned earlier. My other company is called Dose, D-O-S-E. And we're at dose.net, and I am starting that as a certified cannabis nurse, doing consultations for patients who are cannabis patients or CBD patients, because a lot of people don't understand that you need to have a balance or a ratio of THC to CBD to really derive all the medical benefits from it. And that's why I stepped up, and there's medical cannabis nurses across the country, mostly on the West Coast and the East Coast. Here in the Midwest, we're a little slow to pick things up like that, but we're getting there, and patients need that extra guidance and help. So
And I've never even heard of that before.
yeah.
And I'm thinking, wow, it's just, yeah, it's one of those things that are needed, because doctors can't do it. And so I take it that you go through some kind of special training.
Yeah, I've gone through a lot of training and a lot of certification. I have read every book I can get my hands on medical cannabis. I belong to several national organizations of cannabis clinicians. You know, I read research daily about it. So there's a lot coming through, and there's a lot of information out there on it. And it's important. It's, you know, as nurses, we like to educate and help. So you think of a cannabis nurse like somebody who's a newly diagnosed diabetic. The physician says, you are now a diabetic. Here in my orders, I'm writing that you need to go see the nurse educator. So you go to see the diabetic nurse educator, and she's the one, or he's the one, that tells you what it's about, shows you how to use your medicine, shows you how to monitor your medicine, follows up with you, answers your questions. It's that personal relationship. So the cannabis nurse does the same thing with cannabis patients.
That is awesome. That's
Yeah.
awesome. So do you find that just the CBD works better on some things, or it works well enough on any illnesses particular? You talked about anxiety, you talked about inflammation and pain. What about like with seizures? Aren't they looking at CBD?
But yeah, that was the beginning of it all, right?
Yeah.
With
Yeah.
our with childhood seizure disorders, and that's how CBD started gaining that popularity. So there's research being done on CBD for cancer, CBD for diabetes, CBD for all of these ailments, but it's all still in clinical trials. So the solid evidence that's been put out, and there's tons of it, is mostly anti-inflammatory, insomnia, anxiety, PTSD, all of the things that derive from those symptoms. And, of course, CBD and THC cannabis has been used medicinally in civilizations, back 5,000 years to ancient Asia and India. And, so it's been around, but it's being researched and tested now.
And that's awesome, because that's what's, because you get different generations and they're kind of like, oh, they're just trying to come up with an excuse to be able to smoke that stuff, where it doesn't. It has such great medicinal purposes. Well, and I remember when I worked for the VA, this was at the beginning of my nursing career, and on their hospice unit, they were giving them Marinol. And it wasn't even legal, for anybody else, but they were giving it and it was helping. And I was like, well, how come the government can do it, but we can't, and
right.
So I just think the more education there is out there, that people, you got to break down the science. You got to know what the molecular structure is, and then it starts making sense. And then you can start, realizing what combination works best as far as THC and CBD.
You're right.
Works best.
Yes, totally. And it's totally individual. So what works good for me is not going to be the same thing that may work for you or, any other person. It's very individual based on, your body composition, your metabolism. If you've done CBD or THC or cannabis before, or you're cannabis naive, what symptoms you have, how severe your symptoms are, what medications you're taking, the comorbidities. I mean, there's all these factors that go into it that we as nurses are used to taking down these histories, doing assessments, and looking at the person holistically and helping to guide them through. And with that guidance, they're able to maximize their cannabis so that it saves them time and money, because cannabis can be expensive. So if you're just out there trying to figure it out yourself, you dabble a little here, you're not sure about this there, and you never really optimize it medicinally. Now, I don't know why anybody would have to justify smoking a joint to get high, because people don't justify going to the bar and drinking or, or making any other thing to make them feel better. And nobody has ever died from taking too much cannabis, and they found a lot of science out there for CBD use in this opioid epidemic. So, people that supplement with CBD don't have to take as many opioids. There's mountains of anecdotal evidence out there. And a lot of research, solid research. They don't take as much, so they reduce their risk of overdosing. CBD in cannabis does not, suppress your respiratory drive. So, all of these factors. Recovering heroin addicts, CBD has been researched and shown to help the cravings that recovering heroin addicts get so that they can stay off the heroin. And I know customers that I have personally that use it specifically for that and swear by it.
Right, because there's Suboxone, and then there's the oh
Yeah,
gosh,
and
I just
that's,
won't.
ugh,
Yeah, and there's
yeah,
all these other, the methadone clinic. So all you're doing is
methadone,
you're still taking another, you know,
right,
drug that you can take too much of that isn't good. And it's absolutely
exactly,
true. Nobody's overdosed on THC.
right,
Um, I wouldn't recommend, you know, maybe driving, but you know, it's just not the same.
right, exactly.
And
I,
I'm
I
wondering, because with your dosing with dose.net,
Yeah,
so you're probably also looking at different types of THC, you know, because I hear that there's sativa, or what, I mean, I don't even know what they're
there's
called
sativa,
anymore.
there's indica, there's
Right.
hybrids. Most of them are hybrids these days, and they're just kind of sativa leaning or indica leaning, meaning, you know, they'll make you more relaxed, or they'll help stimulate you and make you more alert and more
Mhm.
creative. So there is that, and there's different percentages of THC and different cannabinoids in each of the strains. So there's a lot of variability out there. And you need to find, you know, sometimes your therapy may be one strain during the day with a lot of CBD so that you can function and work, and then one strain at night so that you can relax, shut your brain down a little bit, calm all that craziness that goes on, and be able to actually get some sleep. Because over 50 million Americans suffer from some type of insomnia. And,
Right.
you know, I think 40 million is the last I saw have anxiety. Well, those
Yes.
people with anxiety, if they take the CBD does not sedate you, but CBD does calm and relax you. So even if you take the CBD at night, I have a nighttime product that's called Rest. And if you take that at night, it just helps calm all the crazy, you know, things that you have going on, and helps your mind relax, helps your body relax so that you can fall asleep. So that's how, you know, it works so well on so many different levels.
Right, because there's enzymes out there like L-theanine that does the same thing, but I think probably CBD is a little bit stronger for that. But let me do my little infomercial here, because I purchased this for a family member. Oh, and you got the tincture. I purchased this for a family member who has anxiety, and he needs to be able to work, and he's super medication sensitive. He
Yeah.
takes a half of something and he's zoned out, you know. So this was kind of a good alternative. And
Yeah.
I wound up trying this. You know, I don't smoke pot because of, you know, I did back in the 70s and I was all fun, but I could get drug tested as well. I mean, that's not so likely the type of work I do, but it's still a possibility, and I don't want to put that at risk. But I used this when I was about ready to lose my, you know,
Yeah.
during some political things that were going on sort of around my neck of the woods. And I took one of these. I go, okay, I'm going to try this. And it worked great. It's better than a glass of wine, in that if I were to have a glass of wine, I'd be relaxed, but it would be affecting my brain. It'd make me kind of a little more, you know, and kind of made me a little more tired and lethargic. That
Yeah.
didn't happen with this at
Plus
all.
the calories. Who wants the calories?
Yeah,
You know?
yeah. With this gummy, it was just like, it just kind of, oh, it did. It just kind of relaxed me. I didn't feel high. I felt like my brain could totally function. So I'm telling you, this is, you know, a go-to, instead of having sometimes to have a glass of wine to unwind, or if you're feeling wound up. Because let me tell you, being a psychiatric nurse, there is a lot of anxiety out there. And when you talk about the assessment, you know, I have to do the same kind of assessment with each of my patients, and they have to maybe take something during the day, not
And
take
don't
as
you
much.
want to just have them all line up and give them a little CBD? Just say,
Yeah.
okay,
And it's the same thing with their medications. They
Right.
only take one tablet in the day, but they'll take 3 tablets at night. But it would be nice to have something that's also helps with their anxiety because
Right.
benzodiazepines are addictive and that's not
Yeah.
good.
No.
And, you know, you just have to keep increasing the dose on that. So yeah, I could totally see CBD, not so much THC with my psych patients because that causes other problems with their psyche and can increase the paranoia and that kind of stuff. But yes, I could definitely see with the CBD.
Sure. And when you take it, you know, like you said, it's not like you take it and you feel like, oh, it's kicked in. But if you check in with your body, you know, and if you check in, you can tell, "Oh, I'm not as anxious. You know, I'm
Right.
breathing a little bit better, a little bit slower. You know, when you check in, you can tell that it's kind of leveled things off a little bit, but not to the point where you feel lightheaded or you can feel it coursing through your veins.
Intoxicated, yeah.
And people love those gummies. So I'm a sugar addict. So I made sure that my gummies didn't have any sugar. You know, some of these gummies, you look at them and they've got that sugar coating on the outside, and there's all these fun colors. So they're all artificial colored and artificial flavored. When you take my gummies, they're broad spectrum, which means they have all the complementing cannabinoids. So even though they're only 10 milligrams, they do so much better than a gummy that is 10 milligrams of CBD isolate, which is what a lot of people use for their edibles, is the isolate. And again, the isolate's cheaper and it takes a much higher dose. So really, if you're taking a 10 or 20 milligram CBD that's sugar coated and has artificial colors and is, you know, is isolate, you might as well just buy a box of Dots or Sour Patch Kids. It'd be cheaper and it'd be about as effective.
Yes, yes. So, and I don't want to, and I'm not one to say, okay, well, let's just keep taking pills for whatever's going on with us. I mean, we have to be aware of what is going on with us and to do other things like meditation and things like that. But
Sure.
There are people though that really do, even not my psychiatric patients, that do have had experiences of trauma. There's a lot of trauma out there that
There's
people
a lot
have
of
no
PTSD.
idea about. Yeah, it's very tough. You know, childhood trauma and people that just have anxiety disorders that they don't know where it comes from. You know what else I was thinking about with this? Maybe this would help all those women when they're going through menopause. I just thought about that.
Actually, there's a lot of women out there that use cannabis for menstrual cramps and for, you know, leveling out their and balancing their body systems. Because, you know, when you're going through something like that, the endocannabinoid system is our body's own system to help maintain homeostasis and balances. But when you strain it and you keep stressing it day and day and day and day, and it becomes more of a chronic issue, it can't keep up. So that's where, you know, the phytocannabinoids in cannabis are exact matches for our body's own endocannabinoids. And that's why it works so well for us on so many different levels.
Oh, I just love that chemistry talk. It's so legit, you know, you can't argue with it. You can't argue with it.
Yeah, I know. I'm basing everything in research. And like I said, I've read, you know, dozens of books on cannabis and CBD and THC and lots of research papers. So, you know, it only strengthens my resolve that there is a lot of people out there that this would benefit and be really good for.
Well, and I'm just so excited that there's nurses out there that want to help it, that are taking it seriously as a medicinal purpose. Because, you know, I look at you and who would ever thought that you have your own CBD business, right? You know, I mean, if there's a face that, you know, if you can't trust your face, who can you trust? Because nurses are the most trustworthy profession out there, that people feel the most comfortable and trusted with nurses. But yeah, I mean, you're not like somebody like, hey, come here, I got something for you, you know?
No, I want to bring this to mainstream America. Yeah. You know,
yes.
I want people to understand, and it's only through education that they'll understand how well this works for them and how there's an alternative to what traditional Western medicine is offering us that we can use that's better for our bodies, especially as we're getting older. You know, you don't want to keep polluting your body with a lot of chemicals that are hard on your organs to process. So many people are going more towards a natural medicine approach and looking for alternatives to those aches and pains that don't have all the side effects.
Right. Well, and as a matter of fact, in the area, I live in a rural area and it's very agricultural, and there's farmers and such. But I tell you what, when I did home health, it was the elder population that was going to the newly opened cannabis stores because
they're smart.
Well, the gabapentin and stuff was either not working or was making them too dopey, and they couldn't keep taking the pain pills, and it's not good for them, and it's a high risk for falls.
Right.
They found with the salves and stuff for
Yeah.
their neuropathy and their sciatica pain. I can't tell you how many elder people told me, especially for their neuropathy and sciatica pain, how much.
And arthritis pain. A lot
Yes.
of my patients use,
Yes.
and honestly, the CBD, you know, Christy uses it as a massage therapist, but you know, even if you just get my tincture, you don't even have to go out and buy a lotion or a salve. You can buy the tincture and add it to your favorite lotion, and use it topically that way. Because, and the reason why I don't carry any CBD lotions in my product line or salves is because I find all the salves being too greasy and it gets all over everything, which drives me a little crazy. And the lotions are all so expensive that I would rather use my body lotion that I'm already using and just add a little CBD to it. It absorbs right in, and it addresses directly to the location you need it, which is amazing.
Right, because everybody's got their favorite lotion. So, wow,
Right.
That's perfect. That's perfect.
There's my little hack.
All righty. So let's get back to dosing. Here's a thing, because I'm, playing devil's advocate, and it's like, well, aren't you still like kind of taking a drug? You do CBD and you do THC. And it's like, yes, but you're still taking drugs for hypertension and for anxiety and all these other things. But with some medications, like for anxiety, like I was talking about with benzodiazepams and such, that you have to keep increasing and increasing and increasing the dose. Does the body build up resistant, like for pain, with the CBD and THC that it has to keep increasing?
So it does, depending on how often you take it and how much you take. You may find that over months, or some patients even over years, find that the same dose is not helping them as much as it used to. So either their symptoms are increasing or the dose they're taking just isn't addressing their current symptoms.
Right.
And in that case, they stop taking it for a day or two, clear their system, and go back taking half the dose that they stopped it at, and it'll kick it back in and recalibrate them so that they can take it. So it's a really easy solution they can do for themselves. And it doesn't, again, you're not going to get addicted to it. It's not going to hurt your organs, like increasing these benzodiazepines. It's not going to cost you a fortune. So there's a lot of benefits to just getting away from all of that. And a lot of people have weaned themselves off of a lot of prescriptions. Now, I don't advise them doing that without a medical professional who's familiar with cannabis to help them do that, which is another reason why a cannabis nurse or a cannabis trained physician is a good idea if you're going to be looking at getting off your prescription meds. But so many people have been able to do that successfully. And you can read story after story after story online about these people and how they've done it. And it's true. And so it's enlightening for a lot of people to hear other people's stories and see that they've been able to stay off of their opioids, or if they've been able to stay clean from heroin, or they've been able to reduce so many of their other medications because they've implemented a regime of cannabis into their daily lifestyle.
Yeah, I'm telling you, having the elderly around here talk about how much it's helped. It's like, okay, if these, I'm going to say for the most part, pretty conservative folks are
Yeah.
saying it helps, and there's no risk of them getting dizzy or intoxicated and falling,
You don't have a
or
bunch
having
of
problems
stone
with
seniors walking
constipation.
around.
Yeah, maybe get a little extra zip going on. I don't know.
You know?
Yeah. So that's what I'm really happy about, is that it's so much
Yeah.
safer than other medications
Yes.
that have all these other side effects. Okay, now here's a side effect. Does CBD or CBD with THC, because I'm a girl back from the 70s,
Yeah.
does it cause you to have the munchies?
So here's the answer to that. THC does has been shown in research to stimulate the appetite. Anecdotal research, tons of people will tell you yes. CBD does the opposite. So that's why it's so good to take them together, because CBD kind of mitigates some of that. So CBD is more of an appetite suppressant. Not to say that you can take CBD as a weight loss drug, but it does, but it does suppress the appetite to the point where if you take it in combination with the THC, it balances that out. So there's research out there that shows that people that use cannabis regularly have a lower body mass index than people who don't use it regularly, which goes against all that, stereotype that you see out there. That perpetuates the stigma, of the lazy couch potato who's giant overweight and just smoking joints and getting high. People that use cannabis have a lower body mass index overall as a population. And there's research after research that shows that.
Wow. That is
How about that?
wonderful news. I
Yeah.
know. Yeah, I mean, I just kind of came to mind, and I was like, yeah, what about the munchies? And that's awesome.
It's a side effect of THC, but that might be a side effect that you want from the THC. So if you have somebody doing chemotherapy, or if you have somebody who has wasting syndrome, or who is suffering from HIV and not able to gain that weight and needs to be able to gain that weight, a side effect of the THC is appetite stimulation. And so you want to help guide them to a higher THC, slowly ramping them up so that it doesn't knock them on their butt. But, if you slowly ramp them up on the THC, it does help stimulate that appetite. And that's a side effect that you want.
Right. That's what I mean. It's the best of both worlds. Because
Yeah.
I remember, this is way before I ever became a nurse, but I was working at a nursing home, and there was depressed elderly people there, and some of them started wasting weight, the failure to thrive. So they started giving them a glass of wine at dinner, and lo and behold, they're enjoying themselves, they're eating, they're conversing. So I could totally see how something like CBD, THC, would help.
I mean, if it was up to me, it would be in all the nursing homes.
Yes.
Right?
Yes. Yeah, because plus, so many of them are losing weight, and they're at risk to fall because of all the other things that they're on.
Well, and depression, and all of that.
Yeah. Wow, this is great information.
I'm going to chime in.
Okay. Go
Well,
ahead,
I've really been listening. I'm really excited to hear you guys embracing this. I've been a medical marijuana user for 7 years, and it started with a series of car accidents where I got head trauma as well as body trauma. And so the first month of being on oxys and as many anti-inflammatories as you could take, I remember looking at my doctor and saying, this has got to stop. I can't do this. Right. And back then in 2012, 2013, you could get a medical card, but nobody would help you. There, you had to go to a backdoor doctor, and I still do. I go to a backdoor doctor to get him to sign off on why I get medical marijuana, and I pay $420 a year
Oh my
So I
God.
can use medical marijuana. And a real doctor, not a real doctor, but a doctor does not sit down and talk to me. I get funneled through. Yeah, it's just a process. And I sat in the community because I'm a massage therapist, I'm a healer. And there's places where you can go and people gather and you can use your medication. And I looked around and there are so many sick people.
Yeah.
And there are so many people that need help. And I was just looking around going, oh my God, but there's nobody helping them. All they're doing is handing them this card.
Yeah.
And that's it. And nobody's telling them what to do, how to do it, how to use it, whatever. And, you know, I make my own medicine and I know the whole thing, but not everybody's educated. Not everybody has the means. And so they just are flapping in the wind and following whatever. And there hasn't been any deaths yet to, you know, due to cannabis, but, you know, they're learning how to concentrate it to potency that is becoming dangerous. And I know because I was at the forefront of it. I've helped people use THC like chemotherapy. And so I also, that's how I became familiar with the CBD, is using that in conjunction, because if you OD on THC, CBD brings you back from that.
Right.
And I know that from helping people using THC as chemo. That's your only hope and your only help. So I'm really excited for you guys to do this, because I myself have managed 3 concussions and a broken leg, like broke my leg in half, broken leg.
Ugh.
Only using, I had to use oxys. My doctor told me 3 days. He said, promise me you'll use oxys for the first 3 days, because I broke my tibia and my fibula in half. And so there's a lot of hardware and stuff. And he said, give me 3 days of good rest and relaxation. I want to know it's healing. And then you can use your THC and your CBD. And I did. And so like I managed that myself. And I've been able to talk to some of my doctors about it, but not everybody is. And people hide behind fear, where like, I'm not afraid to tell my doctor, I'm going to go smoke pot to make me feel better. Because they know how much pain I'm in, you know, but not everybody's in that situation. Not everybody's that strong. So I really see this as a new area that's going to expand and blow up and really start helping people. And at first it's going to be hard. I'm sure a lot of times you're trying to rein people in to cut down a little and, you know, use it like you're supposed to, because they mix the medicine and the fun, just like we kind of probably do with alcohol. You know, alcohol has medicinal properties, but it's really fun too. So how do you keep people on the medicine and not just overusing all the time?
Right.
That's a great story, Christy. You know, that's a great story. And you're absolutely right. And that's why I founded Dose, because there isn't anybody out there that people can turn to. And I don't know if people are mixing medicine and fun. I don't think they understand that there is a combination in a way that you can take it to make it more medically or medicinally helpful for them, aside from just getting them high. So, you know, some patients don't know that there's more to it than that. And that's where a nurse's education needs to come in and help guide them, you know, because a lot of people try it and they're like, oh, I just got stoned. I couldn't take it. It was too much for me. And they move on to something else when they really didn't give it a chance because they weren't taking it properly. And so, you know, you go through a lot of trial and error when you don't have somebody guiding you. And you go through a lot of money and a lot of time that you end up, you know, not really optimizing your medicine. So I'm glad you're on board, and I'm glad you've got yourself to a point where you know how to take it and make your own medicine. I'd like everybody to be able to make their own medicine.
Yeah, that's great, Christy. And the whole time I kept thinking, okay, so get a hold of Jeri at dose.net.
Yeah, I'm happy
dose.net, because I never really thought about that people kind of figured out for themselves when they got their marijuana cards. But really, we don't know what we don't know. Right. And so you're just like, well, yeah, this kind of worked, this didn't, or this, like you said, worked too much. So you go to somebody that knows exactly what it is that you need to work for your particular situation.
And, you know, Jan, it's true. And I've talked to a lot of medical cannabis doctors in the area here, and they tell me that, you know, even when they explain to their patients and give them more information, actually going to the dispensary can be very intimidating for people who have never done it before, because the dispensary experience is unlike any other shopping experience you've ever had. And it can be a little intimidating. And, you know, the bud tenders, as knowledgeable as some of them are about the products that they have, are not medically trained. So if
Right.
you've got somebody who has a lot of comorbidities or taking other medications or intricacies in their care, you know, the bud tenders can't really help them. So they end up walking out with a little bag of something and they're not sure if they've got the right stuff or how to use it, you know.
Exactly. Exactly. That's why I think what you do is so wonderful, because yeah, let's put the education behind it. And who better than a nurse, because everybody loves nurses. They do. They look up to us, you know, and they rely on us to be truthful and to provide that support and the education.
Right.
And
They have their
more, yeah, even more than doctors, because they kind of get that, you know, white coat syndrome. Whereas nurses, they don't so much.
Right. Because we have their best interest at heart.
Mm-hmm.
You know.
Because it's a whole holistic approach of what we always look at anyway.
That's right.
Yes. Which is what Positive Life is about. The whole holistic approach.
I was going to tell you, we all know doctors can fix things, but the nurses keep you alive.
Aw. Thanks, Christy. Yeah. Do you have any other information, Jeri, you'd like to pass on? I'm not thinking of any particular.
I can talk about cannabis all night long, but you know, I have a lot of education, and people can reach out to me on either of my websites. You know, it's tuliptreecbd.com or dose.net, dose.net, and you know, they can contact me. I'm happy to help guide people through these things. It's really important that people have the knowledge and are able to feel secure in taking that. And I'd also like people to feel comfortable talking to their healthcare providers about cannabis. You know, when I managed a cardiology group up in Chicago, I'd overhear patients coming in and talking to the doctor and say, you know, do you think cannabis would be right for me? Or do you think cannabis is a good option for my mom or dad? And the doctors would say, I really don't know enough about it to recommend that for you. And so that would be the end of the discussion, which would break my heart, you know, and I couldn't necessarily go in there and say, wait, let me tell you about it, you know. So that's why I did my own education. I got certified as a cannabis nurse, you know, and I educated myself so that when I do speak to people about it, I want them to be able to understand and know that that stigma and all that they've heard in the past in the cannabis prohibition is not true. You know, it's fabricated for a bunch of different reasons, but you know, come talk to a cannabis clinician and they'll help you and guide you. You know, even if you don't come to me, there's a lot of us online. You can look at, you know, search, Google us. There's a lot on the East and West Coast, like I said, because they're a little more progressive than the Midwest. But, you know, any of us are happy to be out there and help you. I belong to a national organization of cannabis nurses. It's actually called the American Cannabis Nurses Association. I belong to the Cannabis Clinician Society. I belong to all of these organizations, and there's a lot of us out there that are really trying to move this medicine forward and educate the public.
Right. And like I said, it has the least amount of side effects. It helps for so many different ailments, you know, from hospice to anxiety to, you know, what about like people who get chronic migraines?
Yeah, there's research right now going on about cannabis and migraines with some very promising results. Absolutely.
Yeah. Okay, folks, tell your loved ones, tell your friends, anybody who you know is taking anti-anxiety medications or pain medications, or things aren't working for them, or they have a marijuana card, or they buy marijuana for CBD or THC for their ailments, but they don't know what to do, contact Jeri at Tulip Tree CBD and at dose.net. I just think that's awesome. I just think it's great.
Thank you.
Thank you so much. Thanks for joining me, Jeri. Thank you, Christy, for your great input and questions. And I'm looking forward to the feedback I get on this. And for the rest of my audience, if you've heard about this and you've missed it, or you want to tell your friends about it, you can find this on my YouTube channel. That's Jan Boal Positive Live. And there's a series of, like I said, I've done 7 shows. And what Positive Live is about is a holistic approach at viewing things for your mind, body, spirit, environment, and energy. That we are all of these things combined. And if one of these areas is out, it affects everything else. It's, you know, it's that chain reaction. So I just want to be able to offer information and education. Take what you like, ponder what you maybe not so sure about, and you can always ask us questions. You know, you can contact who's ever doing, who my guest is, or myself, and we are more than happy to talk to you, because that's what this is about. It's about opening the lens and your possibilities. So thank you so much for joining us, and see you next week.